How to treat inguinal hernia without surgery. Part 4.
Chapter 4. Of the causes of hernia. All the causes of hernia usually alleged may be resolved into two kinds: those which diminish the resistance of the abdominal muscles and those which increase the pressure of the viscera. The cause most generally predisposing to this disease is debility. By occasioning relaxation of fiber, it produces a dilation of the apertures through which the spermatic vessels pass, and thus affords a passage for the protrusion of the viscera. The same cause also operates in elongating the attachments of the viscera, rendering them thereby more extensively mobile and consequently more liable to be displaced from their natural situation. If a person, debilitated by fever, returns to a habit of violent exertion before his strength is fully re-established, a swelling of the groin will often occur, which proves to be a hernia. A gentleman, aged 24, requested my advice regarding a hernia that appeared after a fever without any cause that he could assign, and an incipient one might be perceived on the left side. Old age also, from the general relaxation which it produces, is so frequently attended with this complaint that I have been surprised to find but few old men entirely exempt from it. Since I have had this publication in view, I have neglected no opportunity of procuring specimens of this disease, and, on inspecting the bodies of old people, I have scarcely ever been disappointed in finding either inguinal or femoral hernia. The subjects which I have examined, however, have principally been old persons who have been obliged to labor for their subsistence after their strength became unequal to great exertions. Those who work hard and live more on fluid than solid food are also very subject to hernia. Whence its frequency among the poor of this town, who work to the utmost of their strength and subsist very much upon liquids. Footnote: the proportion of ruptured persons in the metropolis may be judged of by the report published by the London Trust Society. An account of the ruptured persons relieved in 7 years was published by the committee, by which it appeared that out of 7,910 cases, 6,523 were males and 1,387 females, and in this number, the proportion of men labouring under inguinal hernia was 4,036, while only 34 women were afflicted with this form of the complaint. Ed. End of footnote. Heat of climate and seasons, warmth of clothing during the day, and warm covering at night must also be reckoned as predisposing causes of this disease. Hernia, though frequent in England, are much less common here than in the south of Europe or in Africa. A gentleman thus writes from Malta, "This is the place where hernia should be studied. For, from the extreme relaxing heat of the climate, assisted by the constant exertions which the inhabitants are obliged to make in passing their rocky paths, few persons escape the disease, and it is often of an enormous size." In Egypt, too, we have the testimony of medical men who attended the late expedition that hernia are extremely common there, and often of an unwieldy bulk. Of this, Sir Robert Wilson mentions the following instance. "I saw a man who had a belly hanging down from his navel to his ankles. A blue skin contained his bowels, but which seemed so thin as to be liable every moment to burst. The weight was enormous, and the size appeared much larger than an ox's paunch. The unfortunate wretch was otherwise in good health, and crawled about gaining his bread by begging." Footnote: the labouring class of Asiatics most frequently met with in this country, and known under the name of Lascars, are by no means subject to hernia. This I had attributed to the small size of the bones of the pelvis, which allowed less opportunity for the escape of a viscus. Mr. Hislop, who has had great opportunity of acquainting himself with the diseases of these persons, has favoured me with the following communication. During 6 years I have been surgeon to the Asiatic seamen of the Honourable East India Company, and I have not found that hernia is a frequent occurrence. These men are very temperate, both from religion and necessity. A Lascar never exerts himself to the utmost of his strength. His nature is too indolent to be roused to any great effort. These people sit in a position that brings the muscles, which pass from the inside of the loins to the top of the thigh, in great and constant action, so that these muscles must be full, hard, and unyielding, thereby filling up the space under Puppar's ligament, and the internal ring through which the spermatic cord passes. Ed. End of footnote. There are also other causes which diminish the resistance of the muscles and their tendons. Thus, a person naturally fat who has become suddenly lean is in consequence generally the subject of hernia. For the fat, which had loaded the spermatic cord and had extended the apertures to and from the abdomen, being suddenly absorbed, room is left for the viscera to supply its place. In some respect, it appears to depend on hereditary conformation of the parts of the groin. For I have frequently been consulted by fathers, themselves wearing trusses, for more than one of their sons afflicted with the same complaint. A gentleman applied to me with his 2 sons, all labouring under the disease. The father had a right inguinal hernia, the eldest son an umbilical, and the youngest a ventral hernia, between the ensiform cartilage and umbilicus, from a deficiency in the linea alba. Dr. S., his grandfather and great-grandfather had an inguinal hernia brought on by the same cause. Violent efforts while out shooting. In such cases as these, I have found by attentive examination the abdominal ring very imperfectly formed, so that instead of the ring extending an inch in length, it could be traced nearly halfway to the ilium. Hence, it would seem that in these persons, the tendon, which strengthens the superior angle of the ring, either does not exist at all, or is, at least, very imperfect. For whoever is in the frequent habit of dissecting the abdominal ring will find it varying both in extent and in the firmness with which it is closed, being in some subjects carefully shut by the transverse tendon from the ilium, while in others this tendon is very small or even entirely wanting. In such persons, the slightest cause is sufficient to produce hernia. Hernia is often suddenly produced by blows. A gentleman consulted me concerning a tumour which had appeared in his groin after he had been thrown from his horse in hunting. He fell upon the post of a gate, which struck against his groin, and he immediately felt great pain, and found a swelling in the part, which proved to be a hernia. A young gentleman from America who had a hernia told me that it appeared immediately after having received a kick from his schoolmaster. Neither of these, however, was oblique inguinal hernia, but a variety that will be hereafter described, produced, I believe, by a laceration of the tendon of the internal oblique and transversalis muscles. Violent actions of the abdominal muscles, by the pressure which they exert upon the viscera, become frequent causes of hernia. It is in this way that coughing produces this disease. Children have occasionally been brought to me with this disease appearing during whooping cough. Few persons who have long been asthmatical are free from it, and those who play upon wind instruments are more subject to it than others. But of all the causes of hernia, the most frequent is lifting heavy weights, an action which strongly exerts the abdominal muscles at the time that the body is bent. In this position, the lower part of the abdomen is not contracted to the same degree as the upper. The viscera are forced downwards by inspiration and compressed by the abdominal muscles above, whilst the openings of the groin are relaxed by the posture of the body. I am informed that few persons are more subject to hernia than the men who work in our dockyards. The great weights which they are in the habit of lifting, and the stooping positions in which they often work, will, I think, sufficiently account for this circumstance. Persons who suffer under habitual costiveness are not only subject to hernia, but have the symptoms of strangulation often brought on whilst at stool, owing to the strong pressure made on the abdominal muscles during the difficult expulsion of feces. Hence, it is right to caution persons subject to hernia to avoid every cause of constipation. Strictures in the urethra appear to be a very frequent cause of this disease, as the difficulty in passing urine necessarily calls for more powerful action of the abdominal muscles. In the body of a man who had a stone in the urethra, which I opened with Mr. Weston, surgeon in Shoreditch, we found several hernial sacs. A man was lately in the accident ward of Guy's Hospital, who had an inguinal hernia appear soon after he began to labour under dysury from enlarged prostate gland. Footnote: I have the notes of a variety of cases of stricture brought into Guy's Hospital, accompanied with inguinal hernia, and it is by no means uncommon to find this complaint in persons who have been afflicted with calculus in the bladder at a late period of life. their abdominal muscles being called upon to act with increased force at a period when the resistance of their parietes is weakened by age. Ed. End of footnote. There are causes of this disease that principally affect the viscera, and in which the abdominal muscles may be said to be nearly passive. Thus, the viscera become too large for the cavity of the belly in an extreme degree of obesity, which loads the omentum and mesentery with fat, and they are compelled to protrude through any opening that presents itself. If the fatness comes on very rapidly, it seldom fails to produce this disease, as the abdominal muscles cannot immediately accommodate themselves to the enlargement of the belly. The following case, sent me by Dr. Powell of Northiam in Sussex, is an instance of an elongated mesocolon causing a descent of the gut, and, as it is interesting in other points, I insert it at length. J. Richland, aged about 45, corpulent, of short neck and stature, originally strong and healthy, but, for several years past, addicted to excessive drinking. On the 2nd of January 1812, had a slight fit of apoplexy, for which he was bled, purged, etc., and was pretty well recovered. About 18 months ago he brought on a hernia of the left side in assisting to lift a barrel of liquor. It was easily reduced, and he constantly wore a truss. On the afternoon of the 4th of February, the hernia descended, and instead of instantly attending to it, he rode home on horseback about 3 miles. On his return he tried to reduce it, but ineffectually. About midnight I was called. The hernia had descended to the bottom of the scrotum, was found hard and inelastic. All my attempts to return it were abortive. The taxis was not painful. He complained of very little uneasiness, sickness, pain of stomach or back, 2 copious bleedings in the erect posture, ad deliquium, purgatives of salts and calomel, strong opiates, warm bath, cold topical applications, tobacco clysters, etc. were to no purpose. The last remedy I had lately found very speedily successful in a very threatening case in the neighbourhood. But indeed, in the present instance they were not retained a minute, as there was instantly an irresistible desire to void them. From the feel and appearance of the tumour, I at first hoped that the hernia had been merely omental, but as the symptoms increased and he had no evacuation, it became pretty evident that the gut was included. Yet after 36 hours the symptoms were still mild. There was some retching and a little vomiting, no hiccup, little pain or tension of abdomen, little heat of skin or quickness of pulse, and he occasionally got some sleep. However, as all probable means had been employed, I now wished to perform the operation, but yielded to the advice and opinion of a gentleman many years older than myself. The following morning we found our patient much worse, the pulse quicker, the thirst increased, great tension, though without much tenderness of abdomen, constant sickness and frequent vomiting, and in the last vomiting he threw up a small quantity of coffee-coloured fluid. The operation was now resolved on and performed. In dividing the integuments and fascia, nothing occurred to delay, but the division of a small artery of the scrotum which was secured by ligature. The whole of the hernial sac being now in view, a small opening was made near the lower part. A portion of fat instantly protruded, which I then supposed to be omentum. But on continuing the division of the sac to within half an inch of the ring, the colon presented itself at the superior and anterior part, much distended and highly inflamed, and was everywhere covered with a bag formed by the mesocolon, except at the open space left between the ring and the margin of the bag. The mesocolon therefore had descended before the colon, and the superior and convex surface, with the 2 longitudinal bands, were placed in the opening between the crescentic margin of the bag and opening through the tendon to the cavity of the abdomen. As I could with some difficulty introduce the point of the finger through the stricture, I endeavoured, though ineffectually, to empty the distended intestine. I now introduced the blunt-pointed knife between the sac and the tendon and cut through the stricture. The intestine being now relieved from the pressure, I found that the whole posterior part of the protruded mesocolon adhered to the hernial sac so firmly as to form in appearance one body. On examination, I discovered also that the adhesion was continued within the abdomen, beyond the reach of my finger. It extended full 4 inches below the ring, and the whole breadth of the sac, and from the external to the internal margin of the opening in the tendon. I now endeavored to return the intestine alone, but its connection with the mesocolon made it impracticable. What was now to be done? In parts so firmly coalesced, I could not attempt to separate the mesocolon from the sac, as I should, at every touch of the knife, have been in imminent danger of wounding either the intestine or the spermatic cord, or both, and as the adhesions were continued within the abdomen, the attempt would have been abortive. I resolved, therefore, if possible, to return the sac with its contents into the abdomen. But for this purpose, it was necessary to enlarge the opening, after which it was with some difficulty effected. At this moment, the patients were seized with copious vomiting of dark-coloured flocculous fluid, so common and so alarming a symptom in diseases of the intestines. The parts were again forced down, but were immediately returned. The wound was then dressed and the patient put to bed. The return of vomiting soon produced the same effect, though an assistant constantly applied his hand firmly to the part, and it was impossible to prevent it. It was soon obvious that nothing was to be hoped for. The vomiting returned every few minutes, he soon became insensible, and outrageous for his favourite liquor, gin. He frequently passed wind per annum, and had a small fetid stool. He sunk gradually, and died about 48 hours after the operation. On dissection, I found that the protruded intestine was about 8 inches of the sigmoid flexure of the colon, with its mesocolon and 2 appendices epiploici each about 4 inches in length, and as thick as the last joint of my thumb at their extremities. I had no time to dissect, but with a good deal of force separated the hernia from its sac, and found it adhering to the peritoneum with the abdomen about 4 inches. The intestines contained no great quantity of feces, but were extremely distended with air. The small intestines were highly inflamed, and near the extremity, the ileum was of a very dark colour. The whole of the colon was greatly inflamed, at places approaching to sphaculus, especially in the part included in the hernia, though still retaining some firmness of texture, and not yielding to the pressure of the fingers. The omentum was also inflamed, and by the distension of the intestines, pushed up quite into the epigastrium. I know not whether there is anything curious in this case. If there be, it is perhaps the manner in which the mesocolon descended before the intestine, and its adhesion within the cavity of the abdomen. Independent of the condition of the parts, the operation was certainly too long delayed. From the firm adhesion, it seems probable that the hernia had never been completely reduced, but that the mesocolon had always remained down from the beginning. If the state of the parts contained in the hernia had been previously known, I presume that the operation most likely to succeed would have been to dilate the ring and return the sac with its contents unopened. The same effect is produced by constant external pressure, which tends to diminish the cavity of the abdomen, the size of its contents remaining the same. It is thus that hernia is brought on by wearing the breeches very tight about the waist, which pinch up the belly and do not leave sufficient room for the variations that occur in the size of the viscera after taking food or from exertions of different kinds. Mechanics, who are in the habit of using the implements of their trade against their abdomen, bring on the complaint by pressing the viscera to the inguinal regions. The enlargement of the uterus in pregnancy sometimes occasions hernia, but less frequently the inguinal than the other species. Distension of the stomach operates in a similar manner. A frequent and forcible pressure or shaking of the viscera downwards, as happens in riding in rough carriages, is a common cause of this complaint. In the town of Yarmouth, where I formerly lived, I knew many persons who had this disease brought on by riding in the small carts peculiar to this town, and which, from being constructed without springs, were rough and uneasy, and shook the rider in a very severe manner. Coachmen who are much upon the box, and persons who ride rough-going horses, are for the same reason liable to this complaint. The cavalry are much more subject to it than the infantry, and I have known children in whom it has been produced by frequent riding in company with older persons, and constantly going apace uneasy to them. Jumping operates in the same way, often suddenly. I have known many persons, after much of this exercise, complain of a pain in the groin, which was soon followed by hernia. In these and every other cause of the complaint, an upright posture of the body strongly contributes to its formation by keeping up the pressure of the viscera on the lower part of the abdomen.